Good morning, everyone. In today's quick learning session, we're going to talk about digoxin. Digoxin is a drug that belongs to the cardiac glycoside category. Digoxin is a positive inotrope. It's called a positive inotrope because it increases the force of the heart's contraction, which leads to an increase in stroke volume. When stroke volume increases, cardiac output increases as well. This is exactly why we administer digoxin in heart failure conditions. Digoxin is also a negative chronotrope because it reduces the heart speed, meaning it lowers the heart rate. That's why it's referred to as a negative chronotrope. It helps trigger the secretion of acetylcholine by stimulating the SA node in the vagus nerve, which ultimately results in a lower heart rate. That's why we also call it a negative chronotropic drug. Digoxin is also known as a negative dromotropic drug because it reduces the impulse conducted from the AV node down into the ventricles. In other words, it slows down the conduction of impulses. The term dromo is used to refer to conduction, and since it reduces it, we call it a negative dromotropic drug. However, if a patient has hypokalemia, meaning they already have a potassium deficiency, then potassium won't be present on that sodium-potassium pump. If it's not there, digoxin acts as a competitive inhibitor. So it will easily go and bind to the sodium-potassium pump as much as possible, and that could potentially lead to an increase in toxicity levels. So whenever we administer digoxin to a patient, we must ensure that the patient's potassium level is normal, because if hypokalemia is present, more digoxin will bind, and if more binds, the risk of toxicity increases. Whenever digoxin toxicity occurs, the first symptoms we see are related to the GI tract. This means the early signs of digoxin toxicity will involve the GI system, including nausea, vomiting, and anorexia. This happens because when digoxin levels are high in the blood, there's a CTZ center in the medulla oblongata of our brain. Chemoreceptors, or chemosensitive trigger zones, sense this. After that, they send signals to the vomiting centers located in the medulla oblongata. These vomiting centers then relay signals to our stomach, abdominal muscles, and diaphragm, which ultimately triggers the vomiting reflex. In addition, eye-related symptoms will also manifest. These symptoms involve the patient seeing a yellow halo around objects, and their vision will become blurred. Besides that, neurological symptoms will occur, such as headaches and confusion. And finally, cardiac-related symptoms appear, which can lead to bradycardia.